Hello out there. It's another Thursday night, and I'm your host and presenter of the show, For the Record with DJ Abass. Very exciting day today. We're going to be dealing with two topics to start with, and one is the attack on the musician, the artist Rugged Man, which happened on Saturday, I believe, last week in London. He was attacked by some unidentified men at a popular Nigerian restaurant in London. I have two guests on the studio who are going to be here to discuss, the ramifications of that act or that incident on the Afrobeat genre, which is the fast-growing genre coming out of Africa, and in the persons of Shokbe Olajide, Adesope Olajide, and Steve Osage. And also, just this Monday or Tuesday gone, there was an attack on property at the Nigeria High Commission in London. And that particular incident has gotten a lot of tongues wagging and brought out this perennial issue about certain procedural issues and problems at the Nigeria High Commission. So we're going to be talking about that as well, and I have my guest in the building to talk about that, Charles Emeka, the speaker and author, alongside comedian and MC Wale Gates, and that'll be much later in the show. However, I have my first guest in the studio today, who is making great strides in tweaking and turning around or having a new add-on to healthcare in Africa. And no other person than Dr. Funmi Adewara. How are you doing?
Fine, thank you.
Good to have you finally on the show.
Thank you very much for inviting me over.
Oh, always a pleasure. And we get our fair share of ladies on the show. Try to get the balance right before they jump on us, But so achieving ladies. How are you doing?
I'm good, thank you. And you?
Okay, I'm good. MobiHealth. When I heard about it for the first time, I just felt, wow, all I've heard about the health sector, especially from the motherland, has always been not too good news. A lot of our professionals, top professionals, are leaving the country. Ratio of doctors or people in the medical sector to the population keeps, dropping by the day. And you've come up with this fantastic idea. Now, before we actually go into your project, but tell us about the concept itself of telemedicine. What is it about?
Thank you very much, and thank you for the commendation.
Pleasure.
Yeah, as you have already alluded to, there are lots of challenges in the African healthcare landscape.
Yes.
And one of the major problems that we have is the shortages that we have with doctors' numbers. Telemedicine essentially means the provision of clinical care from a distance.
Okay. And
what it means is that you can provide virtual consultation to patients without necessarily being in the same room with them.
Okay.
On a typical day, you go in to see your doctor in the hospital.
I was there yesterday.
Okay. And then the doctor, you narrate your problems, the doctor takes the history, detailed history, taking physical examination. If he needs to have blood tests, he would order investigations and things like that. If you need follow-up, he will arrange a follow-up
Very
appointment.
one-to-one.
Yes. But now, with digital revolution, you do not necessarily need to go into the hospital before you get seen by a doctor. And that's what telemedicine is all about. It is not entirely a new concept. I mean, it's been in existence for more than 10 decades.
It's 10 decades?
Yeah, more than that.
Okay.
It's well established in the US,
okay.
and it's now gaining popularity in Europe, in the UK here as well.
Okay.
What is different now is the fact that we now have digital revolution, making this more accessible in a different way, in a more secured way, and in a highly scalable manner. And that is what MobiHealth is doing. We're leading this initiative in Africa, being the first integrated model.
The first? That's a big first.
Thank you.
When did the idea pop in your head? Obviously, you're a practitioner of many years. You've been in the game long enough in different capacities. Talk about that.
Well, first, I trained in Nigeria as a physician, and I trained in Ibadan, and I did my first 2 years in Ibadan, in Nigeria. As a medical student, I came in contact with patients, and also as a young medical graduate. And this gave me the first-hand experience of the challenges that millions of people face trying to access just basic healthcare. And when I came over to the UK to pursue my residency program, I also decided that I wanted to make an impact on a global scale. I love clinical medicine, the fact that you can see patient one-on-one, but I think that there's more that I can offer on a global scale. And that's why I decided to do this course in Cambridge. And
a particular course?
Yes,
yeah, okay.
Bioscience Enterprise. And that springboarded me into the entrepreneurship that I found myself in healthcare today. And so the idea has been in me for a very long time. As a medical student, I was very involved in various healthcare campaigns, organizing symposium, healthcare wellness initiatives. I was the vice president of the Action Group on Adolescent Health, and also the chief medical director for the camp clinic for the National Youth Service Camp that catered for more than 300 COP members. So this has always been in me, and I'm very fascinated that coming to the West has broadened my horizon and given me the necessary tools that will that's helped me to make an impact on a global scale.
It's such a huge project, you know,
It is.
because if I look at the landscape, I'm thinking a nation of 200 plus million people, 36 states, 774 local governments, the logistics alone of making this happen. And this is an initiative that kind of like came to life fully just a few months ago when you did the launch.
That's right.
How have you been able to walk around that minefield in the initial?
Right. Okay. So it's a very, very big project, like you have rightly mentioned. We have launched in Nigeria. Nigeria is our first entry market, but we haven't rolled out in all the states. So we've decided to roll out in about 7 states.
In Nigeria?
Yes. Lagos, Kano, Kaduna, Oyo State, Port Harcourt.
Big states?
Yes, about 7 states. And well, that's the beauty of telemedicine. The fact that because we're not a brick and mortar, so there's no distance barrier, there's no language barrier, there's no, so that is the beauty of telemedicine, that you can easily scale up. You can see as many patients as you want within
if the personnel on ground,
Exactly. So telemedicine allows you to be able to, so MobiHealth is mobilizing more than 100,000 doctors globally to provide video consultation to patients in Africa. And this is a very big project indeed, yes.
And Africa obviously being your first hub.
Yes.
Is a long-term plan to make it global, ultimately?
Well, the market, people ask me this question all the time. Why are you not going to Europe? I mean, the need is in Africa. This is, for us in Europe, those in the Western countries, it's more about convenience. You don't want to go to accident and emergency waiting 3 hours just because you need to be seen for a chest infection or ear infection or malaria or wherever. But in Africa, it's a matter of life and death. So you have millions of people dying needlessly every day from very preventable causes. So that is where the need is. The market is big. We're talking about more than 95% of people in Africa not having any form of health insurance. And the shortages of doctors, you know, increasing. According to the president of the Nigerian Medical Association, a few months ago, he did mention that more than 2,000 doctors leave Nigeria every year. So imagine.
And usually the high-end ones as well, you know, the consultants.
Correct. So you have 72,000 doctors to a population of 200 million people. More than half of them are already outside the country, like people like myself. And then you have 2,000 leaving every year. It's a crisis situation.
Major.
But the beauty of it is that telemedicine can change the narrative quickly.
And fast.
And very fast. Because Africa is one of the fastest growing markets when it comes to mobile technology adoption. Nigeria has more than 85% mobile penetration, 30% smartphone penetration.
So that's a good start for you, really.
That is a very good start. They already spend $600 million every month on airtime and data, spending more than 2 hours every day surfing the internet. We want to convert this to providing quality care to those who need it in the most cost-effective and time-efficient manner.
In your setup and your build-up, what's been your biggest challenge so far, or challenges?
Well, there are quite a few.
Because obviously you have to go through, you know, what has that been like?
Well,
licensing and all the other elements.
Now, I wouldn't say it's good or bad, because Alibaba said, the CEO of Alibaba said, when you go to any country or you want to do a business as an entrepreneur, if everything is ready, then take your leave, because there's no opportunity for you there.
Indeed,
So in terms of the regulatory environment in Nigeria, unfortunately, there's no blueprint for the adoption of telemedicine per se.
Did you help in
right
creating
now?
one?
So we are coming in from a very high standard, being that we are from the UK.
Yeah.
So we are HIPAA compliant, GDPR compliant. We're putting all these things in place even before it is needed. So when the law is
Eventually,
ready,
yeah.
then it will catch up
Fit
with
in.
us. We're ready to work with various stakeholders, regulatory bodies, to make sure that the system is transparent and that it is safe and that telemedicine can be adopted, because it's a viable alternative or viable option to bridging the gap in the African healthcare landscape.
I want us to paint a picture together now.
Correct.
So, my mom had a stroke a couple of years ago.
Right.
She was 79 at the time.
Okay. I'm sorry to hear that.
Oh, well, my mom she's a tough one, you know, and she just took it in her stride. We got 6 children, only one pretty much available to help at home. So, if I was telling you about that right now, it wasn't 2 years ago, and I said, look, I wanted to put MobiHealth to plan. What would, just paint a picture for me, how would that work?
Well, very interesting.
And she lives in Oshobo.
Yes.
Yeah.
So, MobiHealth, when I told you about us being the first integrated model,
Yeah.
we've developed this model it's more of a one-stop shop for a user's healthcare need.
Okay.
And interestingly, patients with chronic diseases like those who have suffered stroke or
Yeah.
who have hypertension or can be managed more closely with telemedicine. So telemedicine is a very good option for those who have chronic diseases. It enables their carers, the doctors to interact more closely and enables you to monitor their conditions before and reduces the risk of hospitalization.
Okay.
So with MobiHealth, we have doctors from across various specialties of medicine. So not just general physician.
On ground in Nigeria?
No, we're
Or
talking about
globally?
the global.
Okay,
but we
yeah.
also have doctors on ground in Nigeria.
Okay.
So when in your mother's case, we have different packages
Yeah.
for different population, and in your case, it will be her subscribing to one of our pre-existing condition packages,
Okay.
and that means that she will have a dedicated doctor.
Somebody goes to her.
There will be doctors on ground and
Yeah.
clinic. What's it called? Nurses,
Okay.
physiotherapists, speech therapists. They can go into her house and look after her.
As quickly as possible?
As quickly as possible. We have home health. We have home delivery of medication. Some of our lab tests can also be done from home.
Okay.
So we can send providers in to monitor and to take care of her. And interestingly, you can also monitor and contribute to our care from here.
Okay.
So this is the opportunity that we're bringing to Africans, to Nigerians generally.
I just wanted to paint that, a typical picture, because at times people struggle to imagine how does it work, what's it going to be like. And you've talked about, I was going to ask you how the width of scope in Nigeria, which is your starting point, you've talked about seven states kicking off. Now, in terms of the physical examination component, how do you address that? How does a doctor conduct physical examination, within the context of telemedicine now? So just to paint that picture, and you touched on it a bit, but digging deeper.
So it used to be that this was one of the disadvantages or some of the shortcomings, if I may, of telemedicine, that you can't do a thorough physical examination on a patient when you're doing. But things are changing rapidly.
Okay.
We have remote physical examination devices that enables the patient to do their physical examination.
Themselves?
Yes.
Under guidance?
Under guidance. Under guidance.
Yeah.
It's very easy to use. And they can upload these virtually through the cloud. And the doctor can listen to their heart sounds, the chest sounds. They can take ear examination. They can do throat examination, abdominal examination. So we have these remote devices. And this is one of the things that sets us apart from other telemedicine providers, that our patients or those who subscribe on our platform can have these remote devices that enables them to conduct a physical examination, and the doctor can listen to their heart sounds or whatever vital signs it is.
Accurately?
Yes, accurately. Okay. And it is FDA approved.
Okay.
From
the States, yes. Yeah. Okay. Now, we now come to the big one. How affordable is it? In terms of the packages and...
Well, that's one of the benefits of telemedicine, that it healthcare cost significantly. It is a fraction of the cost. Do you know that the actual cost of treating uncomplicated malaria is only 6.6% of the total cost?
Uncomplicated malaria?
Yes. Okay. The rest of the cost is spent on facility maintenance and personnel.
Movement, travel.
Exactly.
Okay.
So with telemedicine, you can cut costs significantly. And We have different packages, different subscription plan for different pocket sizes, from individual solo plans to family plan, and it is quite affordable when you think about what people are paying right now and the cost of our prescription plan, and the fact that we are the one-stop shop for all your healthcare need for the year. So we take care of your medicine. You don't pay anything else out of pocket for medicine, for video consultation, for diagnostic tests, and when a small percentage of people, maybe about 20%, seen on our platform may need further referral to the hospital for further care. Maybe they are too ill or they need further evaluation. We cover the costs for them. So this is a all cost covered subscription plan, and it is really affordable.
And will I be right to say that in the overall scale of it, really, the earlier any potential I don't want to use the word client, patient, you know, subscribe early. You don't wait till you get ill, really.
Absolutely.
Exactly. So I think with MobiHealth, if I like thinking of back to my mom again, I said, look, mom, this is it. Don't call me. Just go there, you know, let them do what they need to do. Doing it early kind of like can forestall anything on the long run.
That's right. That's right. So in terms of primary prevention, secondary prevention, you know, you don't have to wait until you're ill before you subscribe. We have a culture, unfortunately, in Africa,
that was what I was driving at.
Where people wait until they are ill. They don't believe in insurance. We're not a health insurance company. We're a telemedicine company. But less than 1% of the population have health insurance. People wait until they are ill before they subscribe or before they go to the hospital. Then they have to pay significant cost towards that. Some have to sell their properties. Some have to go into debt to cover the cost of their treatment. And some just resolve to quacks. So for MobiHealth, our subscription plan are very pocket friendly, and if you're a diasporan and you have families back home, you can subscribe for your families and pay direct debit, a very low cost direct payment plan, set up some payment plan and cover the cost of their treatment. Then you have peace of mind because you don't have to go looking for how to pay for their subscription for treatment differently, how to pay for medicine and hospitalization. All the cost is covered on an annual subscription plan. Okay.
And for those watching at home now who just want to get to know a bit more in detail, where can they go to right now?
Well, our app is live on Google and app on the iOS, for iOS and for Android. And it's MobiHealth Consult. Just type MobiHealth Consult. It has a blue ambulance and you can subscribe there. We have different subscription plans. You can subscribe to any of the plans and you're covered. Our website is www.mobihealthinternational.com.
Okay, awesome. Thanks for coming on the show. That was such a, because part of what we try to do on this show is just to show options of the new Africa, how things are developing, and actually gives me great pleasure. I'm sitting with a Nigerian, you know, powering this.
Thank you.
That's more important. So we're here to help and support.
Thank you very much. It's my pleasure. Thank you.
Guest has been Dr. Funmi Adewara of MobiHealth International. You've heard it. And they say an apple a day saves the, how you people say it? Yeah. So jumping in quickly, my next guest is already in the studio. Stay tuned and we'll be right back.